Everything you need to know about amniocentesis. It is a medical procedure used to determine the health of a baby before it is born. It is also referred to as amniotic fluid test or AFT. To begin this procedure, your doctor will use an ultrasound imaging to create an image of the fetus and nearby structures, then display it on a computer screen. Looking at the image, the doctor will choose a safe place to insert the needle. Your doctor may give you light anesthetic to numb the surface of your abdomen where the needle will be inserted. While carefully watching the ultrasound monitor to avoid contact with the placenta or the baby, your doctor will introduce a long, thin needle through your abdominal wall into your uterus and into your amniotic sac. The doctor will then collect a small sample amount of amniotic fluid, remove the needle, and place a Band-Aid on site. Since the amniotic fluid provides protection and nourishment to the baby, it contains the baby's cells that will provide the doctor with the right genetic material for testing. Amniocentesis is usually done in the second trimester of pregnancy, 15 to 18 weeks, and is often offered to women with certain risk factors. These risk factors include age 35 and over, due to the increased risk of chromosome abnormalities such as Down syndrome, previous child or pregnancy with birth defects, blood test or ultrasound suggesting a birth defect, or family history of genetic disorders such as cystic fibrosis. This procedure can also be done in the third trimester, 27 weeks to the end of pregnancy, for these reasons. To determine maturity of baby's lungs if early delivery were to occur, to check for anemia in the baby, and to diagnose a urinary tract infection. After this procedure, there are a few things that could happen. You might have to avoid physical stress for 24 hours. You might experience light cramping or pressure. You might get a urinary tract infection. You might have a miscarriage.